Okay, hello everybody. I am Ahmed Mordi, MD, Consultant Intervention Radiologist at Royal Bahrain Hospital. We met many times before in Gulf Association for Endocrinology, Bahrain Endocrinology Conference of Dr. Wian, and Arab Association for Thyroidology and Thyroid Endocrinology. Um, these are my disclosures. These are my conflictions. We met since 2023 um, in Gulf Association of Endocrinology and Diabetes Disease, and again in 25, and Arab Association for Thyroid and the Pan-Arab Association for Intervention Endocrinology, and in the Gulf edition also, and during Badr 2025 and 2026. Okay, our topic today, we will just go for the very first time for something diagnostic related to diagnostic imaging. I always talk about intervention radiology practice in thyroid diseases and parathyroid, and also for different endocrinology topics. Okay, let's dive in this topic about the elastography and artificial intelligence in the imaging of thyroid and parathyroid advanced perspectives. The evolving of the thyroid imaging was deeply needed because, as we you know more than me, the thyroid cancer is the third most globally scattered thyroid cancer. And with the conventional ultrasound, the B mode, there is some sort of limitation and it's operator dependent and it needs experienced diagnostic radiologist to quantify the lesions within the thyroid and the parathyroid to detect which lesion is which, benign or malignant. To give an idea about the intervention radiology related treatments for the some sort of nodules. We are transitioning from subjective observations to quantitative assessment to get a very good effective treatment within thyroid diseases. The ultrasound elastography, there is two principles: strain elastography and shear wave elastography. The strain elastography, it needs some sort of compression by the probe, and the shear waves elastography doesn't need this. The elastography means to detect the stiffness and the elasticity of a specific tissue. It's used by the ultrasound, by the MRI in the thyroid, in the liver, in different lesions like breast, MRI, and things like that. The strain elastography, it's operator dependent. This is a very big pitfall. And the shear wave elastography, it's uh, really limited within the very small lesions below 10 millimeters. For technical optimization, the AI, it's currently used within these machines that offer the elastography. And actually, the shear wave elastography, it's becoming a built-in software within the machines that will be delivered to endocrinology heavy cases centers. So the goal to use elastography to quantify the tissue stiffness, to differentiate between the benign lesions and the malignant lesions within the thyroid specifically. Okay, we are depending on the elastography to detect the stiffness for the stiffness velocity, for the stiffness elasticity, maximum of elasticity, the diagnostic accuracy for the diagnostic accuracy for the maximum elasticity for the shear wave elastogram. it's almost very, very high, and the area under curve, it's indicating a very, 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 very good, robust quantitative stratification. Actually, we need the elastogram in the nodules that was classified after the FNA as category 3 or almost early category 4. Because if the stiffness is very high, so this is a very big indicator for malignancy. If the stiffness is very low, so this is a big indicator of possible benign lesion. And we have to take in consideration that the subcentimetric nodules, we have to use the parameter of mean elasticity instead of maximum elasticity if it's below 10 millimeters. This will give a very high accuracy for to detect this lesion if it's benign or malignant. And we have to take in consideration that the deep lesions in the posterior part of the thyroid, especially if it's enlarged thyroid, it will give a very high pitfalls and artifacts. So we have to keep away from elastogram. The clinical integration for this in the shear wave elastogram for the thyroid is to combine the TIRAD classification with what you see and what you get for the stiffness velocity. In my work, let's come to a very practical point. In my practice, I'm using elastogram for all the thyroid nodules before ablation. If it's a benign thyroid nodule, I will do just a very quick elastogram just to get the stiffness velocity for this nodule. If it's below 30, I will get a very good results for the ablation. If it's beyond the 30 kPa, almost this nodule after ablation will not respond very well to the ablation. So I have to interpret this to the patient to prevent very high expectations that will not get a very good results. So the use of artificial intelligence in the thyroid ultrasound can depend on the neural network and visionary models for real-time analysis. Actually, the machines are now containing the AI by accumulation of the different images of the lesion and assessment of elastogram and the lesion characters and the lesion stiffness. Almost the machine can tell you if this lesion or this nodule within the thyroid of the patient, if it's almost benign or almost malignant. And they can guide you how to go for further next step. We are using actually the machines containing this models containing artificial intelligence merged with shear wave elastogram that can follow the TIRAD classification in automation or automatic process that can give you all the needed parameters to build a very efficient treatment plan. The parathyroid imaging, the new frontier. For the parathyroid adenoma, to differentiate the hyperplasia from the thyroid tissue, the AI can tell you about this, can give you an idea about this. But this is in a very high-tech, high-end advanced machines. It is not applicable in the whole in the all companies. The artificial intelligence application, the parathyroid localization, can depend on injection of the radiation materials, can build automated segments of the images, and they can tell you after isolation of the thyroid tissue, if it's a thyroid and or parathyroid. If it's isolated with the thyroid, so it's a thyroid nodule. If it's not isolated, so it's parathyroid hyperplasia. And they can fuse the ultrasound image with the CT image and combine both together to give you a very good idea about the imaging. This is depending on the artificial intelligence. The the advantage of this, it's integrating the multi-parametric data to detect the thyroid lesion and to guide you in the assessment and of course for the treatment. From the intervention radiology perspective, for the guiding ablation, as I told before, the elastogram is actually using to detect one single number, the shear wave elastogram, specifically to detect the stiffness velocity. If it's below 30 kPa, or if it's beyond 30 kPa, 30. Please remember this number. If it's below 30, you will get a very good results for the ablation and very good shrinkage, specifically for spongiform nodules. If it's beyond the 30 and it's benign by FNA, the results for shrinkage in relation to time and the volume reduction rate will be very slow. So you have to tell your patient about this and you have to illustrate this with your patient. For the clinical guidelines and the consensus, the very recent ones, the Arab Thyroid Association has their recommendation, and there is global updates coming from 2025, and there is some paradigm shift depending on the elastogram and the AI as a non-invasive biomarker. For the future is depending on and going through the AI applications to give you a quantitative, automated, fully integrated clinical assessment and clinical report for what's got in the imaging during the ultrasound. Because of this, I think the machines will use their probes soon by themselves. These are two very good two articles. You can depend on them to get more data about the AI in the thyroid imaging and about the shear wave elastogram in relation to the classification of the thyroid depending on artificial intelligence models. And you can know more about the physics of the elastogram and the AI if you are interested in this. So to conclude, please know that science is going and artificial intelligence is going, and we are running after them to catch some of the advances. The integration of the artificial intelligence and shear wave elastogram are not optional now and are not experimental tools. They are reality and they are critical tools in the modern imaging ultrasound machines. Actually, it gives a very improved outcome, and this is making you to decrease and reduce the number of unnecessary FNAs. And you have to know that the paradigm of the thyroid imaging is going to quantitative, automated reporting to help the intervention radiology treatments. The future of thyroid imaging is a quantitative, automated, and interventional, and minimally invasive. Thank you. And for questions, I'm here to answer your wonderings. Please know that we introduce the thyroid interventions as a non-surgical treatments across the whole GCC countries, and you can ask about the very advanced practice in Bahrain with Dr. Wiam, the head of the endocrinology department at Royal Bahrain Hospital and the chairman of the Badr. Thank you and see you next time.